Hello.
Hiya, hello folks, testing. Right.
Sarah, just to let you know that I need to leave at about 12:30 for a maternity services meeting. I think Catherine probably needs to be there as well.
Thank you, Marta. Yes, I did know that. Thank you. Just going to give it a couple of minutes. We've got people still joining, and then we'll kick off. Just give people a chance to get into the call. Right, I think the numbers have stabilised, so I might kick off. So good morning, or good afternoon, just about, and welcome everybody. For those who haven't met me before, I'm Sarah Betterley, the Trust Chair. I'm just going to start off with a few apologies. We've had apologies this morning from Andrew Dina, from Leslie Seary, and from Caroline Roberts. And as Marta said, she is with us for half an hour and then needs to drop off at 12:30. And obviously anyone else who needs to do so will drop off. But you're very welcome to our AGM. And this is our annual general meeting actually for last year. So that's why we're doing it at this time of year. We've got the agenda there. I'm just going to make a few opening comments, and then I'll be handing over to Matthew, who can talk to us about his update for the year, and then on to Mike to talk through the financials. And there, of course, will be time for questions at the end. So, as I say, a very warm welcome. I'm absolutely delighted to be here as the new chair for the Trust. I think I've done 8 weeks now, so I'm feeling quite well settled and getting to know people, which is wonderful. Jackie Smith, who was our previous chair, she left us after the general election when she joined the government as Education Minister, and she's also become a member of the House of Lords. So she was obviously very busy doing that, and her departure gave an opportunity actually to review the collaborative work across the acute trusts in North East London. We obviously work very closely with our partners, and what was decided was to renew and to reinvigorate the work that BHRUT, Barts Health and Homerton Healthcare are doing as part of the Acute Provider Collaborative, which was already in place, and to help with that work. And I think to improve care for residents across North East London, the decision was not to replace Jackie with a chair in common, but for each of Barts Health, BHRUT, and of course Homerton to have their own chairs. And 3 of us as new chairs have recently been appointed and taking up our positions. So we're going to be working very closely together and, as I say, reinvigorating the work of the Acute Provider Collaborative. So I am very fortunate to have taken on this role and to be the chair of a trust that has seen such significant improvements over the past year. Most notably, and of huge significance, is the fact that the trust is no longer under special measures, and after more than a decade of having been in that position. And it really is a reflection of the hard work, the dedication of the staff right across the trust, improving patient care, financial management and overall operations. So huge congratulations to everyone, because that is a significant step forward for the trust. Additionally, we're really proud as a trust to be a London living wage employer, and we've also got 400 of our staff, so that's 5% of the workforce, participating in our apprenticeship programmes. And in addition to that, and building on it, we have been granted main provider status, which will allow us to offer apprenticeship programmes to people in other organisations. And that is a really significant accolade and demonstrates the strength and the quality of our own apprenticeship programme. So again, something to be really proud of. So all of this, the progress that has been enjoyed over that previous year, has been achieved by the 8,000 staff we have from 146 different countries. And I'd really like to say a huge thank you to all of you for what you have done, and for everyone's involvement in the care, the great care that they've actually shown for our patients. So that's fantastic. So I'm settling in. As I said, I've been here 8 weeks now, and I'm visiting as many teams as possible over the next couple of months as I move around the hospitals and our various sites. So I've met many people already. I've had a really warm welcome. I'm really enjoying that, and I'm looking forward to meeting many more people, because I've got plenty more visits to make. So from a context of where we are now, obviously the pandemic is over, as we know, but that doesn't mean we shouldn't lose sight of the fact that we're still living with its legacy. And it does have a long tail in terms of impact on the NHS generally. As Lord Darzi highlighted in his recent report, the NHS is still under pressure, and some of our patients are still waiting far too long for their outpatient appointments, or they're experiencing unacceptable delays when they visit one of our A&E departments. And we know just how much pressure those teams are under. Implementing the Darzi recommendations is a top priority for the board. Its focus is on service transformation, integration, reducing waiting times, and tackling health inequalities aligns really well with our own goals here at BHRUT. So by adopting these recommendations, we can modernise services, delivering more seamless, patient-centred care and addressing those healthcare disparities that affect the most vulnerable people in our community. Now, I don't want to steal Matthew's thunder, but one of the many highlights from the past year was the opening of our Community Diagnostic Centre at Barking Community Hospital. It's a great facility, and it has already been receiving fabulous patient feedback. It's one of the most deprived boroughs in the country, and it will perform, in one of the most deprived boroughs in the country, and it will perform an extra 50,000 scans and tests a year, which is magnificent. In addition, a further 38,000 will be carried out at our new CDC that's opened at St George's Health and Wellbeing Hub in Hornchurch. I could go on. There are plenty more successes to talk about, but I'm going to hand over to Matthew and let him tell you more about those successes, but also the challenges we've experienced as a trust, because there are many and they continue. And then after Matthew, as I said, we'll be hearing from Mike Gillam, our Chief Finance Officer, and he's going to talk about the difficult financial situation being faced by the Trust and by the NHS as a whole. So Matthew, I'll hand over to you. Thank you.
Thank you, Chair. So I'll just run through some slides just to say for anyone joining or watching this afterwards, we are talking about the year 23-24 here. The reason for that is that we had some historical accounting matters just to correct that dated back to around 2010 actually. So this is why we're around a year out of sync with this conversation. So some of what I say is reflecting on a time period considerably before this one. Some of what I'll say, for example, around A&E pressures will be a bit more rooted in what we're currently facing as well, but I'll try and keep it as much as possible in the year to which this AGM relates as well. So next slide, please. So a couple of bits of really good news for the organisation. BHRUT has left special measures. The Trust was put in special measures predominantly around concerns about its financial position as well as waiting times in the emergency department, but a range of other measures around leadership consistency, medical leadership, staff welfare, etc. So it's been very good to get the support of NHS and of the Integrated Commissioning Board in North East London to take us out of that. It's not just a regulatory measure, it's something that affects morale within the organisation. It affects people's perceptions of the organisation when they're thinking about applying for jobs here. And it also, in some cases, sort of fetters your ability as a leadership team to make decisions about things that you want to do. So the move out of special measures has been really positive on a number of fronts. It was a great achievement on behalf of the whole organisation. We also very much did it with the help and support of NHS England and other partners who very much got alongside us to enable us to do the work we've needed to. So thank you to everyone who's helped us with that. Our determination is now very much that never again becomes an issue for BHRUT. The greatest risk probably remains around the finances, and Mike will say a bit more later actually, but the threat of financial special measures is one that we really would like to banish by making sure we become a sustainable organisation over the course of the next few years. But that was a great achievement. We're also working towards the implementation of our Better Care electronic patient record. This is late in the day for an acute trust in London. We're the last acute trust in the capital to not have an electronic patient record. And what that means is that our patients who come in for outpatients appointments rely on crates full of paper records being drawn out of various warehousing facilities to provide the consultants with the information that they need. It means that people that come in through the A&E might have part of their stay here recorded on an electronic system before then moving into paper. And it often means for patients a frustrating experience of having to repeatedly explain why they're here and what's been done to them so far, and for clinicians to have to go out and effectively track down scan results, test results, and outcomes from previous appointments. So this is a real prize for patient safety, in time for patient experience and in time for staff experience. And alongside the electronic patient record, there's a host of other digital assets coming to us around prescribing, around radiology, imaging sharing, etc., and actually a significant investment in the physical infrastructure in terms of cabling and Wi-Fi across the organisations to bring us into the 21st century, I'd say optimistically, and we're very much looking forward to having that. There was a lot of work done during the 23-24 year that's continued into this year to get us ready for that rollout, but that's a really important thing for us. And we've also done a lot of work as an organisation on our purpose, which you can see there, which is we want our hospitals to deliver care that we're proud of and that our patients are happy with. We think that's something that really resonates with a lot of our staff and also with the people that come to us for care and support as well. And it's something measurable and it's something we're really trying to implement in terms of the way that we work. So there's some really good news around BHRUT. I mentioned the A&E waiting times, and actually we have worked very, very hard to try to reduce the waiting times here. We were last year the most improved in England. I think in this current year we'll be the second most improved in England, despite having already done a huge amount of improvement work in the previous year. We've been inspected by CQC, who've upgraded our ratings as well, really recognising the caring and the attention to patient safety that our staff pay. We've made massive progress on ambulance handover times as well. Queen's has gone from being one of the sites with the very, very longest handover times in England to a much better position, and King George has been tremendous actually in the work that they've done to make sure that ambulances do not wait. That's allowed London Ambulance to get a lot more crews back on the road and drive down those category 2 waiting times. There remain some real challenges. We see a lot of people every day now across our 2 sites. We see around 1,000 a day, which is up from about 830 a couple of years ago. 4 out of 5 of the people that come to us are seen, treated and discharged or transferred within 4 hours. But that still means that around 200 people a day are facing, in some cases, really extensive waits. That's particularly the case for our frail or elderly patients, often who are waiting for beds in really inappropriate circumstances. Particularly at Queen's A&E was built for 325 people a day, now routinely sees over 600 and in some cases over 700 patients, and the consequences of those kind of volumes of people coming in is some real compromises around the quality of care we can provide. And we also see very long wait times for mental health patients who are waiting for admission and treatment into our neighbouring mental health provider and after into other mental health providers across London or into Essex as well. So while we're pleased with the progress we've made, and literally thousands, I think it's 7,000 more people a month are seen and treated within 4 hours than 2 years ago. We've still got several hundred people every day who are facing some unacceptably long waits. Part of that's to do with the physical constraints on the emergency department, part with the pressure on the system as a whole. So there's still more to do, but good progress, but lots more to do. Next slide, please. We're doing great work on cutting waiting lists. The Chair's already mentioned some of the capital investments we've had, and actually you get the best out of NHS staff when you give them really good facilities, good equipment, sufficient numbers of clinical, operational and admin colleagues to get the job done, and let them do what they're best at, which is caring for patients. And actually I think some of the examples, the new theatres at King George Hospital, not just the theatres, the recovery areas, the waiting rooms, the whole suite of facilities we've put there, really first class. And Barking Community Diagnostic Centre, which is not just about the diagnostics we provide, it's also an example of BHRUT really investing in one of the most deprived communities that we care for, and really trying to push as much care as we possibly can out of our hot acute sites into community centres and into places that are much more accessible to some of the patients that need our care the most. The super weeks, the weekend clinics, the extra services that have been run both within surgery, also in general medicines and in medical specialties in gynecology, to really push those waiting downs both for adults and children. And also for a considerable period of time now, we've been delivering on the national standards around radiology performance and making sure that people who are referred for a scan are getting that scan and they're getting the outcome from that scan within the access standards set by NHS England. And so we've done some really good work on that. And at the time of this broadcast, we're currently the best performing acute hospital in London in terms of 18-week waits. Just below 70% of people being seen and within 18 weeks, and I think that's a great place for us to be going into this next year. That's based on the work we did in 23, 24 and before then to really get the organisation in the right place to deliver efficiently here. Finance, Mike will say more about that in a minute, but some of the real big pushes for us was to cut the amount of money that we spend on agency staff and to increase the number of substantive employees that we have for us. Part of that is based on the earlier work I said about getting out special measures, improving the organisation's reputation. And some of this is really about moving from a place where BHRUT was seen as a very difficult place to work with a very challenged history to actually being an organisation where we welcome people who want to come here, who want to work hard, but who want to innovate, who want to change services. We'll support them with their learning and development, and we're trying to make this a better place to work for all of our staff. But what that does in turn is that reduces the costs that we pay out on extra shifts because of vacancy rates. It reduces the number of agency staff in particular who we have to bring in. And that was something that's always sat badly with me, paying an agency member of staff 2 or 3 times as much as one of our permanent member of staff for the same work, often for not as good an outcome as well. So that's really helped us get into that, and Mike will say a bit more about that. But generally in 23, 24, there was this sense of greater financial constraints coming upon us. The year we're about to enter, it's going to be in a different level altogether off the back of that. I think though, probably from a trust perspective, the experience of being in and exiting special measures has really helped us with our financial rigour. And I think as we enter the more challenging financial waters ahead, the fact that we've had that real focus on where we spend every pound and making sure we get the best value out of taxpayers' money within the organisation, I think has put us in good stead for that, along with the really good quality leadership we've been able to develop within the organisation and the great talent we've been able to bring in from external as well. So I think next slide, I think, is that my last one? I think I'll be over to Mike. It's supporting our staff, and this is kind of building on what I've said there, really about investing in people and listening to what they're saying about working here. And this is the kind of strength that allows us to deliver on some of these operational things. You've got examples on this slide here of the No Abuse, No Excuse campaign, which was informed by what our staff told us in our staff survey. That's offering greater protection to our staff for the abuse and hostility they sometimes face from patients and their families. We know that very busy environments with long waits sometimes do create some real pressures, but that's by no means the only place, in which our staff are facing that kind of aggression. So we've really stepped up our efforts to help and support people and protect them from that, because no one should experience that at work. There's also examples of that page on celebration events to recognise the great work our staff do, which we do thanks to the sponsorship and support of many of our external providers who allow us to pay for these kind of events without using NHS money to pay for everything. An example of our school uniform summer fair, where we offer free school uniform for our staff to support them with cost of living. That's one of a range of initiatives we're providing to our staff to make sure that we're seen as a responsible employer that cares for its people and supports them in as many ways as we can. And then in the bottom right, a great example of the apprenticeship programme, which the chair's mentioned, which we've really been building up over the last couple of years to try and become one of the biggest providers of apprenticeship training in the NHS. It helps us attract and retain people, and also as an NHS trust in one of the more deprived areas in London, a really good opportunity for us to invest in local people, whether it's school leavers, people looking at midlife career changes, or people later in their working life looking to get into different aspects of employment. It's really allowing us to bring in and attract and retain great talent from local communities and demonstrate our value as an anchor organisation in North East London as well. And without the staff, we couldn't have achieved anything I've said on the previous couple of slides. So I'm really proud that we're able to keep this investment going as well. So I think that is all my slides for now. I think it's worth reflecting that 23-24 was a really important year for us, and I think gave us the platform for lots of what we've managed to achieve in 24-25, which you'll hear about in our next AGM, which will be considerably sooner than this one. Thank you.
Thanks, Matthew. So I'll provide an update on the financial position for 23-24. So do you mind just moving on to the next slide, please? So our key aims for the year were one, to continue to improve the sustainable financial position of the trust, and two, and linked to that, was exiting what we've kind of called financial special measures, or it's the same thing as the oversight framework 4. To do that, Matthew's touched on some of this. Key priorities were to reduce the excess costs we had from use of temporary staff. We've had a long-standing use of agency staff. Within the year, we reduced the 28 million of spend, but just to put that in perspective, in the first quarter of 22-23, we were spending £3.5 million a month, and we got that down to between 1.5 and 2 million per month by the end of 23-24. And that is a trajectory which has carried on into the current year, where we're actually spending less than £18 million a year now. So we are continuing to reduce that spend and invest more in kind of our own staff, which is great. We also focused considerably on kind of treating more patients through productivity, and that had led to significant levels of increased income. We actually treated or earned 110% of the income that we earned back in 1920, and that has resulted in our productivity measures increasing as well. And we are one of the highest performing trusts in the country in terms of productivity recovered since the pandemic. We achieved our targets or our aims in terms of saving money through procurement. So we saved £3 million, which is roughly 5% of the controllable non-pay spend that we have, and we achieved all of the metrics required to exit special measures. So they were predominantly delivering at least £20 million worth of sustainable financial improvement. We achieved almost 30, and again, something that we've replicated this year, and that helped us to demonstrate quarter-on-quarter reported financial performance. And those things together were what helped us exit from the oversight framework. And we should remember it was a tough year. There was lots of disruption in the year, so we had started the year aiming for a break-even plan with all the industrial action that was around at the time. That was reset partway through the year to about £15 million deficit, which is the number that we achieved. The table at the bottom there shows that in our audited accounts, the actual financial performance that we are held accountable for has improved to 6 million. That's partly to do with the technical adjustments that we've been working through going back to 2010, which linked to the complicated PFI we have at Queen's, and actually more specifically the managed equipment service within that. The details of all that are in the annual report and accounts, which will be published directly after this meeting on the website. But do you mind just moving on to the next slide for us, please? And this is just a bit on the money of the investments. Again, Matthew's touched on some of the great stuff that we've been able to do. We've spent about 25 million of that 48 million of capital spend was actually expanding our services. So through new elective theatres, our CDCs, and things such as the SDEC at our King George site. So all things which are kind of signs of success and confidence in us spending capital money wisely. We also invested about £15 million on backlog and given our staff the equipment they need and the kind of the estate that patients and staff need to work in. So again, we're continuing on an upward trend there where, you know, pre-pandemic we were struggling to spend £7 million a year on capital, which did give us some backlog issues, which we are now getting very much on top of. And we're hoping through 24-25 and 25-26 to have tackled the vast majority of those. So just to say a little bit about 24-25 and 25-26 is I think as we've continued to progress in those key areas of sustainable financial improvement, but going into 25-26, it's going to be an extraordinarily difficult and challenging year. And despite 2 years of delivering about £30 million worth of savings, we are going to have to achieve about double that for us to achieve a break-even plan next year. So it's difficult, but also an opportunity to look at things that we haven't looked at in the past. That's probably all I'll say, Sarah, on the money, but very happy to take questions.
Thank you, Mike, and also Matthew. Really helpful to get that run through of all the key details for the year 23-24. So as we explained, it's this is coming a little bit late, but nevertheless, if there are any questions in relation to that period, this AGM, and obviously the upcoming annual report that, as Mike said, will appear on the website after this AGM, now is the time to let us know and ask those questions if you've got any, and we will field them appropriately. So I'm just going to see if I can check if there's any hands up. Give people a moment. Yes, we have Ron. Thank you. Go ahead. Oh, I think you're on mute, Ron. Can't hear you. I think we still can't hear you there. Don't know if your microphone's on. I still can't hear Ron. Is it just me, or is there something we need to do to free up? Do we need to open up mics generally to a wider audience?
I can't hear me either, Sarah.
So sorry, Ron. We still can't hear you. Is it a question that you could type and we could pick it up from the chat box? Would that help? Shall I give you a moment to do that? And I'll go to Marta, who I think has a question, and then I'll come back to you, Ron, when I've given you a chance. Marta, do you want to go ahead? Because I know you need to drop off in a minute.
Yes, thanks very much for the introductory comments from all three colleagues, Sarah, you, Matthew, and Mike. So you've commented on the fact that we're late in having the annual general meeting because of when the accounts are signed off. So just wanted to confirm, because the document has not yet been circulated, that we've had a clean audit report from our external auditors. I think that would be really helpful. Thank you.
Yes, I'm going to let Mike come in on that one and take the glory for being able to give us an answer.
Yes, Marta, we absolutely have got a clean audit opinion.
Thank you. And Sarah, please ignore if my hand is still up. I'm seeing
That's okay.
problems with my system, so it's a legacy hand now.
That's fine. And thank you for confirming that, Mike. And I mean, it just another example of the great work and the amount of time and effort that's gone into clearing those historic financial issues that caused the delay, but worth waiting a little bit longer to get it properly signed off and a clean bill of health as you described, and to do the AGM a little bit later, but it's right thing to do and worth waiting for. So thank you to you and the team for that. I think the only other question I had was Ron. I think Ron might have popped off and trying to come back in again, so I'll give him a minute. But please, hands up if anyone else has any. Not that you have to ask questions, but if anyone did have any questions, hands up, and I can see if there's anyone waiting. Not at this point, and I do think we might have lost Ron for the minute. Ron, I'm so sorry. I think you have rejoined, or you maybe didn't even drop off, but I don't think we're able to hear you, and I don't think you've put a comment in the chat either. Do we need to try and help with whatever question you were going to ask? 1 minute. Yep, we're waiting, don't worry. Nimble fingers typing away. That's all right, we're looking out for it. Okay, I'll read your question out, your comment out for you. So Ron, you're saying you're concerned that we're congratulating ourselves on the ED performance. However, most of that is due to the urgent treatment centre, with our help, of course. The situation with regard to patients transferred to BHRUT, the situation is still very bad.
Yeah, I'll pick that up.
Thanks,
happily.
Matthew.
So, a significant part of it is down to the UTC. 2 years ago, our Type 1 majors performance was around 30%. So that meant 3 out of every 10 majors patients, which is about 450 of the 1,000 who come through the door every day, were seen and treated within 4 hours. That has increased to over 50%. So we have made a 20% increase in our Type 1 performance, which was part of why we got out of special measures. Over the same time period, the Type 3 performance increased from 75 to around 98, so around a 23% increase in Type 3, along with a 20% increase in Type 1. We also increased our Type 2 performance, which is eyes and emergency gynae, which was around 73, 74%. That's now regular in the 90s as well. So we have seen across all 3 types of performance, particularly in this 23-24 year, that 20% or so increase. Since the end of this financial year that we're talking about, the Type 1 performance is largely stabilised around 50% and does remain very, very difficult. And that is predominantly down to the fact that we're seeing more than twice as many patients in the emergency departments as they were designed for. Despite multiple efforts by the systems, we're working to try to reduce emergency demand. What we've seen is double-digit percentage increases in demand every year for the last 3 years as well. So at present, if we are successful in our bid for additional capital, I think we'll be able to improve the experience of patients at Queen's in particular. Nothing that's currently happening in the system around us is going to profoundly shift the fact that we're going to have frail elderly people waiting a very, very long time for access to beds for the foreseeable future. Although we are hopeful that developments like the St George's frailty service and the work that our geriatrics teams are doing with their colleagues in Nelft and others may help us around that. Ron's right to say the situation is still very bad. Fortunately, it's very bad for fewer people than it was before, but still, certainly, as I said, there's still over 200 people a day who I think are facing unacceptable waits in the emergency department. This should all be seen in the context that at the minute, we're the 3rd best performing A&E in London. So while the waits here are extremely bad, they're actually very, very bad everywhere. And I think it's a really grim picture actually for some of the patients, families and staff who have to work in those environments every day. And I know Ron, as one of our patient partners, is very active in supporting patients and their families in the corridors here, and recognises, I think, that the staff are trying their very best in a really, really poor set of circumstances.
Thank you, Matthew. I think that's really helpful, that it's right to acknowledge the progress made, but never forget that there is so much more still to be done. So thank you for that. And Ron's come back. Most patients transferred to BHRUT from the UTC are waiting well over 10 hours. It's only the 4-hour performances that are good.
Yeah, and 4-hour performance is what the national team measures the performance on. And we're also looking at reducing our 12-hour length of stay, and we have managed to reduce length of stay in the department over the last couple of years. But the all-type performance is a composite of type 1, type 2 and type 3. And as I said, we've seen 20% increases in all those areas of performance over the course of the year that we're talking about here.
Thanks, Matthew. Helpful. Okay, so I don't think I'm seeing any more questions, and there were no further hands up. So I might bring us to a close and say thank you to everyone for joining today. Thank you for the work done to get us here. And thank you for the continued efforts right across the trust to keep pushing for more progress. It's good to see progress, but it's also good to recognise that there's a lot more still to do, and in pursuit of the overall aims of the organisation. And I know everyone is very much committed to and heavily involved in trying to achieve all of that. So thank you, and we will see you all again relatively soon, as Matthew said, because we'll hopefully have another AGM in about 6 months' time. But for today, we'll call it an end. Thank you very much for joining us. Thank you.
Thank you.
Thank you. Thank you.